Hello, everyone. I'm Peter Wintlev from the European Commission. I work here with responsibility for looking at ICT-based innovation, addressing the challenges and opportunities of aging, and I'll be your chair for this session. The purpose of this workshop under the Futurium series is to try to develop ideas for how we would look at this issue when we are 2050, and what are the kind of ideas for how we can really develop opportunities and what can be good recommendations for things that can be done to maximize this evolution in society. I think we're really facing a big challenge, but also a big opportunity here, and I think a lot of discussion should really be about how we can generate opportunities for the fact that we are getting much older, which is really a good thing, and there are lots of really exploited opportunities from such a population that can really be very important for our future. Just to remind you that combined with the increased longevity, we also have had for a number of years decreasing fertility rates, which means that the basic structure of our society is really changing quite substantially. The dependency ratio, which is the number of people working versus those not working, is currently in average in Europe 1 non-working for 4 working, which will change by 2050 to only 2 working for 1 not working. So that's really a major structural change, which is not really sustainable unless we really innovate. So I think let's bring that in here also. It's not just about the older people, it's also about how we see older people in the context of the young people in our society. We're also looking very much at innovation, and we're doing in the Commission quite a lot of initiatives now for some years and trying to see how can technology, on the one hand, help to address the challenges of the needs of future care systems and how to keep people socially included and how to keep people longer at the working in the workforce, which are really elements of this change, but also how can we generate new opportunities, new products and services that are really driven from the needs and wishes of older people. How can older people become the early adopters of innovation? We see a big possible trend that older people will be the first adopters of really advanced things like service robotics, like very advanced living environments, and also older people as innovators as well. So I think that will be good topics for this workshop as well. So with that, I think I'll give the floor to Anne-Sophie Parent, who's Secretary General of the AIDS Platform Europe, and I think she's very well placed to give us the introduction to set the scene. So just a reminder, we aim to finish around 1 o'clock, so we will try to get an interesting discussion out of that. I look forward to it. Thanks a lot, and over to Anne-Sophie.
Hello, this is Anne-Sophie Parent, speaking on behalf of AIDS Platform Europe. Thanks for the invitation to contribute a presentation to explain to you what older people themselves feel about growing old and how it will be in 2050 if we expect to reach a centenarian society. Just a few words about our organization. I won't spend a lot of time, but it's a large network who represents now more than 31 million older people. When we talk about older people, we actually say the 50-pluser. Not all of us like to be told we are older persons, but this is how organizations who advocates on behalf of older people present themselves. And their memberships are usually composed of people aged 50 plus. But we even have members who represent the 40 plus excluded from the labor market. So that means quite a large group of the population. And our role, of course, is to monitor EU policy making based on the feedback from our members. And since we try to cover every EU policy that has something to do with aging, it is quite wide. And of course, the topic of today is going to enable us to cover almost everything we do. Demographic change. Well, Peter introduced you, gave you already the figures. What is expected indeed in the coming decades is a very sharp increase in the so-called 50-pluser. When we look even at the very old age, it's going to be a very sharp increase. So those who are expected to need care and support, the 80-plusers. The dependency ratio is indeed expected not to go in the right direction, with an increasing number of older people being dependent on pensions paid by the younger ones. But this is based on the situation of today. And all those projections, the longer you go, the less reliable they are. And statisticians tell you that they can only make those projections based on assumptions, and the assumptions used are actually based on the way people are living and aging and needing care today, which we hope is not going to be the case when we reach 2050. So the pyramid, you see how this is changing very rapidly in the coming decades, and of course the baby boomers are considered to be the cause for those changes and those challenges for policymakers and for all of us. But we are here and we want to contribute to the solutions of those challenges. One thing I would like to highlight when we are discussing and trying to picture what would be the society in 2050 is that already now we see very major changes in behaviors. Older people up until 20 years ago used to be more or less the same. They had the same expectations and they had more or less the same way of living. Now there are huge differences, but also huge changes in behaviors. First of all, you see that there is a need to look more closely at the differences you can find between people living in urban areas or rural areas. There are huge challenges across the EU, and this is not always highlighted enough. We see also that people are very diverse, but also they have very diverse expectations and they are more demanding. The baby boomer generation is quite different from their parents' generation, who are for the moment in the 80-pluser group, I would say. The baby boomers, they want to be part of the solutions. They want to continue to contribute. They have much more demands, but also they are much more willing to contribute to improving the way our society is organized. The first thing we want also is that every solution should not be developed just looking at the needs of older people themselves, but looking at the needs of all generations, which is quite different from the way advocacy on behalf of older people was presented up until 10 years ago. Now we care as much, if not more, about younger generations as we care about ourselves. And when we are talking about older people, we are talking about very different groups, but also very different age groups. If we look at the 50, 65 years old, most of them still at work or trying to remain at work. And we look at the very old, our own parents, the situation and the challenges are different. But there are so many changes happening for the moment which come on top of demographic change, which make it even more difficult and more urgent to look at a new way to create a society which is really for all ages and a society which would be what we call age-friendly. This is what we are trying to run as a campaign. It's this vision of a society for all ages. And to achieve that, what we think is needed in order to make sure that there will be a future for our children and grandchildren as well, is trying to promote age-friendly environments. Because we know, and this has been the approach promoted by the World Health Organization already since 2008, we know that the environment has a very, very strong impact on the ability for older people to remain healthy and actively involved, but also to remain independent. And the best way is by promoting those age-friendly environments, not only meaning better transport or built environment, but really reviewing completely the way our society is organized, services are provided, how do generations interact with each other. Because this is going to help us lower what we call the disability threshold. That means if you are lucky to live in a supportive environment, in what we call an age-friendly environment, you are able to function independently and to contribute for much, much longer than if the environment is not supportive. And that's where this concept of design for all that we are promoting with the support of the European Commission is something that should be for us the way forward. For the moment, our society is developing very fast. We have new products, new services, new ways of organizing our common life being developed, but they do not take on board always the needs of our aging population. So we should not create more disability than is the case for the moment. And by developing this concept of design for all in all areas of life, we are sure that this will improve cooperation and support between generations. It will also help the younger generations. So what can we do if we want to achieve? Our objective is even, I would say, more ambitious than what we are talking today, because we want to achieve an age-friendly EU by 2020. So that's quite a short time frame, but we know that we will need more time. We will probably need until 2050. And we should use the fact that our population is aging rapidly for the moment, as well as all the opportunities that exist it's through research, through political support from, in particular, the local and regional level, to really promote innovative solutions across the EU to make sure that we find solutions that will meet the needs of our aging population, but as well as the future generations. So we started to work with the World Health Organization, as I say, back in 2008, and we explained to them that what we wanted to do was not reinvent the wheel, but just import their model, their concept of age-friendly environment in EU policy processes and EU funding instruments. Because for the moment, this global network of age-friendly cities and communities has grown, but not to its full potential, and certainly not within the European Union. We know that if we mainstream it in what we are doing, because there are a lot of work being done in different areas which are going to be relevant for age-friendly environments inside the EU, we know that we're going to be able to move much faster. And that's how we asked and promoted to have as one key action the promotion of age-friendly environment inside the European Innovation Partnership for Active and Healthy Aging. And we were lucky that this was agreed. So now through this work, the EIP is working on different actions, all of them trying to promote better health, longer healthy lives, and improve by 2 the healthy life year expectancy within for all European citizens. Inside this EIP, and with the support of a very large network of stakeholders, which involve local and regional authorities, research centers, NGOs, and other interested parties, we are trying now to promote a campaign to really get a network established at EU level of stakeholders who want to promote and join forces to promote age-friendly environments. And we are also campaigning to get a covenant on demographic change, which hopefully will be set up to really ensure that there is a political support and a strong commitment from the local and regional level in particular to promote age-friendly environments. Because for the moment we have seen a lot of pilot projects being implemented, but they do not even sometimes get scaled up in their own countries. So obviously we are missing opportunities there, and now we should use this momentum of the EIP to really go much further. We've done also work to make sure that the legislation that we need at EU level is going to be in place. And there is another Directorate General, DG Justice, who is working on an ambitious Accessibility Act to improve and promote the concept of design for all in all EU policies. This is resulting from the fact that the European Union has endorsed the UN Convention on the Rights of People with Disabilities. So, of course, they are now trying to translate this legal commitment they made into concrete actions. And then, of course, something that we have been supported very much by the Commission also is to promote the involvement of the end users, so all the people themselves, in research projects, in policy making, in areas that concern them. And, of course, age-friendly environments is an area that our members are very keen in getting involved. They will also campaign at national and local level to make sure everybody comes on board. Then, now if we want to try and project ourselves in the future, in 2050, and try and dream about the society, how we would like to see it, I would say we think it's going to be very different. There are so many opportunities for changes that would really bring an improvement to citizens' life, not only older people, by the way, but we see this as a society where there will be huge possibilities using new technologies to improve the health of people, to improve their productivity at work, to improve their mobility, to improve their independent living. There are already projects and initiatives we are starting to look at those approaches, and some of them are very promising. We took a few examples here. For example, there is a French initiative to develop what we call integrated care pathways, but in particular for people with chronic diseases and comorbidity, but who live in rural areas. When you are living in urban areas, it's more or less well covered and you have very good access to quality care. But there is a huge challenge in rural areas because you have a very even more rapidly aging population. All young people go to cities to find work, and then we have older people left there who need care, and this can be helped and improved in terms of quality with the use of new technologies. We have also other best practices like the consortium to implement new practices to improve cognitive aging. We know that we're going to have, the expectation is that we are going to have 115 million people with dementia by the 2050. So that's really a very large group of people. Unless we are lucky to find a cure to Alzheimer and old age dementia, it's a very large group of people who will need very special care, and we need really to have new solutions that will enable them to stay at home in a safe environment for as long as possible, with good support to their family and informal carers, and the best, I would say, support to really have quality life rather than expecting them to all end up in a nursing home. Social innovation is also something which we need to think about, because we cannot just expect everything to come from new technologies and being paid by the public purse. We know that, we are conscious of that, and it's certainly not something that older people are asking for. They want also to contribute their fair share to solutions, and that means promoting more self-care, peer care, but also peer support. And here are a few examples like the Burgzorg in Netherlands, which means caring by the neighbors. It's really a way forward, we think. We will see more and more, and in particular in rural areas where communities tend to try and get back together. We had lost this social fabric and it's coming back. And then everything that has to do with enabling and supporting generations to work and support each other, to live together, is something which there is a great demand, and we hope that by 2050 we will have, I would say, more inclusive, more friendly and cohesive societies to live in. I will not expand anymore because Kasia and Peter said they would like to keep time for discussions and so, but of course I will hopefully have the time to come back with a few more ideas, such as what nanotechnologies can do, not only in the health field, but there is huge work being done by DG Research to try and promote nanotechnologies for helping cope with the aging of our society, be it in work, how to improve productivity of older workers, and mobility, and so on. Even leisure is also covered. So I look forward to the discussion. Thank you.
Okay. Thanks a lot, Anne-Sophie. So I think now let's get some inputs from all the people that have joined the conversation. Do you have anything you would like to raise? And then we can start a discussion. Okay, I can also start off with a question for Anne-Sophie. So I think one of the issues, of course, is getting that greater proportion of the older people in society, and the possible conflicts we see, for example, with youth unemployment and so on. How do you see things moving towards 2050? Will we get another, say, opinion about older people and also the intergenerational aspects that I think will be a big confrontation if we look at it today in the crisis situation. Getting more people to stay longer in the labor market would not necessarily be a popular view seen from the younger side of the population, where we have big unemployment. So what do you think about that?
Short question.
Peter,
Do you hear
I
me
don't
now?
hear you. I didn't hear your question.
Okay.
Okay.
You don't hear me now?
Yeah, now I hear you.
Okay. So there was a question. Probably good if you say your name when you want to intervene, so we know who is speaking.
Herbert Almers, just a question. Do you hear me? Okay, then that's fine. Yeah, may I bring just one aspect into the discussion? Sorry, I think I have to close my window soon. Okay, there are all the technical things like nanotechnology or technical environment improvements, which will help whatever. But for me, in principle, I see the most demanding thing is to use and provide services in a very, very flexible way. So when I think I'm getting older, 65 in a few months, I will do a lot of things, and I plan to do a lot of things, but I will also maybe offer some services or engagement in some areas, but I would do it on a flexible basis, not
don't
on
hear
a
anyone.
regular schedule, so that I can decide. Oops. Sorry. No idea what's going wrong.
I could hear you here from the EU side.
Yeah, okay. So I think at least somebody is hearing me. That's fine. So, but if the rest doesn't, I'm not sure. So in principle, the idea is, if you think about how we share cars at the moment. Yeah, I can just go outside and look at my web application and see, okay, there is a car I can use and share it. So I think about a world where I have services I can use that way. I just grab it and use it, and offers for engagement, I just grab and do it and say, okay, I'm here, I can do something, I can help or whatever. But it must be on a flexible way, not on a schedule every fifth day or whatever. So if we make a information exchange which allows us to just grab offers to engage and grab offers to use services, then I think we have a good chance to integrate it. We can do services for younger people, for example, or whatever. So that's just an idea. I think this flexibility to use the IT environment is very, very important for further, for the future. So, but I assume you're the only one who heard me.
Any reactions to that from the people around? The idea of flexible services and how we can innovate in that. And Sophie, you still don't hear anything?
Probably not.
And do you hear me when I speak?
From the EU side, I say we are doing quite a lot.
Or not?
Yeah.
Okay.
Yes.
Yeah. So if I understood well, the question is around flexible services that you, what about how older people feel about that, and if there is innovation around flexible services. Well, that's certainly the way forward for us. Older people would expect to be able to have services which are really tailored for them, tailored on not only on their needs, but on their expectations, which is quite different. The traditional way of providing services to older people is that their needs is assessed by someone else, and then they're being told you're going to be given that service. But this is now moving away toward a much more person-centered approach. And this is where we need to have much more flexible services than the traditional way of offering them. there is also a very strong trend now, which is more than welcomed by older people, to keep, for example, dependent people at home rather than putting them in institutions. Why? Because all of us want to stay at home until the end of our lives, but also to have quality life during our last years, and that's the best way, is to be at home with your loved one. So we see very innovative approaches which allow this flexibility, but still we see in many countries the old-fashioned traditional way coming back due to cuts which are being introduced, because when you promote innovative solutions in the beginning, they may sound like more expensive. But we have examples like in Denmark. It is actually a municipality which won an award during the European year 2012 on active and healthy aging, where they have completely shifted the way they look after and promote and provide services to older people. And the purpose now is to empower the older person to get their autonomy back rather than provide the service for them. And this is really the favored approach. And of course, with support of technologies and various integrated services, you can empower someone to remain autonomous for very, very long, almost until the end of their lives, which was not possible before through the traditional system. I hope this answered the question you raised, because I wasn't sure of the question you posed, but yeah.
That's okay.
I can also say from the EU side, we're doing quite a lot on the research side to actually develop, say, platforms that can be used to deliver such flexible service, can engage the consumers themselves in designing and checking and choosing those services, and the people delivering services on a much more individual basis. So this is also a technological challenge that we are working on now, but it's certainly the trend for the future.
Okay.
Any further questions? So I have a question for Anne-Sophie as well, which I said before, how we can be more innovative in the way that we deal between generations, because as we can see, especially now in the crisis situation we're in now, there's a kind of an inherent different set of interests between younger people and older people when we talk about the labor market, or how to share this possible burden of the increased cost of care services and so on. Do you have some good ideas, Anne-Sophie, on how we're going to move towards 2050 and what will change?
We are absolutely convinced that people, and actually it is already the case now, an increasing number of older people want to continue to work for much longer than they are even allowed to. You do have some legal barriers that need to be removed, but also the fact that work itself is changing. We are moving toward a society of services where people are no longer facing very demanding, physically demanding work, and many older people will be willing to continue to contribute one way or another. So the way we used to divide our life, where the first part would be studying, second part would be working in paid employment, and third part would be just leisure, as they sometimes label it, is no longer going to be the case, and it's not what older people really want to. Of course, they want to have a little bit easier time and to be able to rest after a long working life, but they really wish to remain involved, and we need to find new ways of involving those willing to continue. We are wasting our human capital for the moment. Every day I meet an older person who is reaching retirement age and who just doesn't want to leave the labor market, but is forced to.
And can we have any innovation coming in to deal with that as well? What could we do that would really facilitate that process also, apart from the regulatory aspects? What are the kind of the key drivers for that change that you see?
Making the workplace age-friendly. By that, you need to adapt the ergonomics, but also you can use, as I was referring earlier, to nanotechnology. They are exploring what they could do to improve, for example, knowledge management systems, to use ICT-enhanced learning, e-skills and e-learning, to be able to organize more flexible workplaces. You know, people may no longer need to really commute to the workplace every day, but be able to work in a much more flexible and timeless way, using new machines and robotics that will help you remain as productive as younger ones in the work environment is also something which is being explored. And then, of course, improving the workplace safety and accident prevention, because we do have still a lot of efforts to do there so that people do not end up reaching retirement age or 65, being really totally burnt out and physically damaged by the work they have had. And those are areas just for the I would say extending working lives where quite a lot can be done through the new technologies. And there are some who are exploring that. Some countries are even investing quite a lot of money on how to make the workplace more age-friendly and how to support the productivity of all the workers.
I think there's also a lot of innovation in looking at what's the interplay between, say, good health and staying active at work, for example, where I think many studies show clearly that once you stop being active and engaged, that has a huge impact on your health status and social quality of life, etc. So I think it's also policy-wise and innovation, looking across those different types of intervention that really in the end have huge impacts, and making this more visible. So also one can see, for example, what's the socioeconomic value of keeping people active as opposed to passive receivers of care.
Yeah, but also just not thinking that you cannot.
I think Andy had a question about.
Was the question addressed to me? Okay.
Yeah, just go on.
A lot of effort is being done also to help people with chronic diseases remain able to function and to work. It's not because you have a chronic disease that you should be considered as ill and unable to work. We are going to see really people who have to combine working and staying active with various illnesses that they have. But if they get support and if they get an adapted workplace or so and adapted working conditions, you are very happy to continue to work even if you have a chronic disease.
I think we have quite some input also coming in on the chat on this. I think there's a general point of view emerging that we really can have a better skills exchange between combining skills of older and younger people as a way of really maximizing the benefits that we can get from intergenerational in an intergenerational labor market. But I think here we are facing still some say negative views from employers, I think, in terms of the value of keeping older people longer in the labor market, for example. Any views on that from people?
Who wants the floor? I didn't understand. Yeah? I see
Okay.
Franco coming in.
Yeah. But looking at some other questions.
I mean, the active and healthy aging, by extending the life expectancy and the possibility to work really until the very last day, creates disruption. But my question is, in broad economic terms, what would be the impacts? I mean, I don't want to generalize a lot, but my feeling is that there is here a turning point. We are in a kind of changing situation, changing a broad economic landscape. So these intergenerational tensions that we can see today is just an early symptom of something that maybe can be even broader. So, or maybe I'm too catastrophist or too optimistic, or no, I don't know that, but I would like really to hear the opinion of the speaker, of Anne-Sophie, but also Herbert, who is still connected, or anyone else on that particular point.
Well, this is the very reason why we are campaigning for this intergenerational approach and this age-friendly environment approach. We certainly do not want to end up with a war between the generations. We know that we, the older people, are more in numbers, and in numbers meaning voters, than the younger ones. And this is certainly not, I would say, an advantage we want to use to only protect our own interests. For us, as I said earlier, we are as concerned, if not more concerned, about the future of our children and grandchildren. And we want solutions that are going to be good and fair for all generations. This is something that changed over the last 10 years, because the movement of older people used to be the traditional way of advocating on behalf of your own interest only. But we see the difficulties, and we want those challenges to be addressed in a fair way for all generations. That's the only way forward for us. It's the only way that will make sense for Europe and make sense for individual citizens, is to have a society where everyone can strive, not just the older ones. And to be able to play a bigger role, we need supportive environments, because for the moment we are preventing from playing a bigger role and contributing more. That's the key reason why you tend to hear negative messages about aging and about older people.
Okay.
Yes, I think that's right. Yeah. In principle, yes. But so I still think elder people are willing to work. Okay, they are in competition, but they will work not all time. So they will decide, okay, they should be able to decide, I do something maybe for the next 3-4 days. If there is flexible services like, yeah, just transport something to another place. It must be a scientific work, and even for a scientist, if he is older all the time. But when he can engage and offer a service, get some benefit out of it, helps the society, then I think he is also integrated, because this is contact with other people. So if we have really something like flexible job offering platforms for older people, which offer maybe even work which is a benefit for the younger ones, because they help in some way, they support them or whatever, then I think we have an integrational part, and we have more acceptance and things like this. The general problem of unemployment, of course, is not solvable that way, that's sure. But it may be help to get a better understanding between the different parts of the society.
Okay. Another issue I think is also, in view of the crisis today, I think the access to care, for example, where I think innovation can play a role in helping to lower the cost of providing care, and thereby giving politicians more flexibility to ensure a minimum level of care, where you could otherwise risk that there's a very strong, say, stratification in society about those that can afford a high level of care and those that will have very little means to do that. So I think that's another view where we see innovation. I don't know, does anybody have a view on that perspective, which is a kind of another driver for how innovation can give more political flexibility, even in a crisis situation, to respond.
Okay, should I? Yeah.
Anne-Sophie, you have an answer to that
Yes,
question?
we can see that there are some initiatives which are really taken in that sense. That means how to reduce the cost of care, but without compromising the quality. On the contrary, improving the quality, in particular with regard to the experience lived by the patients themselves. That's how you see more initiatives to reduce hospitalization by organizing care in a different way. You have less new technologies which have, for example, make surgeries in a much less invasive ways. All those are new developments which are more than welcome because they improve the health outcome, they are less expensive, and in terms of quality of life, they are a huge improvement for the life of the patients. So there will be more and more of those approaches, but the problem is within this crisis is how can we continue to research and develop new approaches and new solutions to provide better care at a lower cost, both for the public purse and for the patient, without having such an impact on the public purse for the moment, because all those restrictions which are put, the austerity measures, may have, I would say, negative impact on what is for the moment in the pipeline and is feasible within the time frame we are facing. We need those solutions to come out and to be deployed very widely across the EU, I would say, in the coming decades, if we want to meet our demographic challenge in a positive way.
Any other reactions to that point? Then I think Seen from DG has raised the question about when we look longer beyond that and how science can impact the way that we age and so on. He would like to hear more about what we could do or should do in research to look at those issues. Of course, I can say something about that, but are there people in the audience who would like to comment on that perspective? What do you see as kind of key drivers for making us more healthy on the long term and really being able to live with a quality of life if we reach the age of 100, so we don't spend the last 20 years in misery? Because today I think we have the problem that we have increased longevity, but the healthy life years have still stayed more or less the same as they were, so we are not really still moving the boundaries for improving our functioning, etc. Do anybody have a view on that?
Nobody is intervening from the audience?
And Sophie, you have an idea for that? We don't see. We very much encourage the people to engage, and if you don't want to speak, you can put it on the chat, and then we can repeat it here if you want. We would like to hear from you, opinions from those of you that are attending the webinar.
Hello? Can you hear me?
Yeah, Edward, you have to speak louder, or maybe it's
We welcome the report, try to bring a better...
We don't hear anything.
maybe turn off your video. Okay, otherwise, Edward, maybe you can write it on the chat and then we can relay it into the discussion if needed, because we couldn't really hear you.
Meanwhile, we can ask Anne-Sophie about the research, because there was
Yeah. So, Anne-Sophie, could you maybe give your input in the meantime on how what you see as important issues for addressing the super Centenarians, the needs for that, and how we can help to also get a better quality of life by getting so old, and what kind of research from your perspective would be important for that? You mentioned nanotechnology as one of the areas.
You know, the people who were 60 in the 1950s are compared to those who are now 80 years old. So we expect that we will also, even if we reach the age of 100 years old, we will not be comparable to those who are 100 years old today. But still, our body ages, and we need to have spare parts, I would say, being replaced, and all those new technologies are doing wonderful things. I just had watched a TV program yesterday which showed that they are hoping to be able to build new kidneys totally from some tissues, and using those 3D printers or whatever technologies they have. They think that it's not going to be for tomorrow, but it's going to come very soon. They're already able to rebuild completely large parts of your skull using Titan, really with new modeling system that you have a brand new head, when just 10 years ago you would die because you had two big holes in your head. There are fantastic things that are being done and potentially are going to be done, which are going to be replacing all those parts that come weak at some stage and let you down, but still your brain and your general health is much better. We hope that that was the case for those who are 100 years old now. So yeah, if we are able to really use all the potentials we have already now for the benefits of the public health, for making it accessible to all of us, not just those who can afford it, which is the big challenge we have for the moment, I'm sure that people will be able to live longer, but still reduce the number of years that they become ill and dependent and become a burden, if some say, to society, as is the case for the moment. Living longer will mean also working longer, but since we will feel much fitter, it is not going to be a problem to work for longer. For the moment, it is a problem for those who are totally worn out because they had very poor working conditions. If you have better working conditions, better adapted places, and flexible organization of your work, I'm sure people will just go on working happily for an extra 10 or 20 years, and the whole thing, life is just going to be expanded, but dependency ratio is going to again be much better. Already now, I noticed today in the news in Belgium that the projections made on the long term about the cost of aging have improved because of new measures implemented, and already the benefit that they drove from helping people to live in good health for much longer. But we need to invest in this area, and that's where the big question mark is. Are we going to be able to invest what we need to invest to make sure that we enable everyone to live long lives, but healthy lives?
Okay. Some of you also mentioned the idea of social inclusion as an important aspect of quality of life when getting older, and how innovation can help to integrate all the people better in their community with their relatives over distance, etc. we have done a number of projects on the European Commission side on that and also trying to measure the health effects of that. For example, it's been shown clinically that depression increases health costs with 30%, so there's a huge benefit case in investing in social inclusion to reduce health cost, which is also the kind of innovations that will probably also come forward. Anybody wants to say something about that?
What I see on the screen is there is a question about the pension cost for extended life, which are going to become unsustainable if people don't work longer. That's certainly what we say. We are, as an organization, and that means it represents the view of a large group of seniors, we want to get rid of mandatory retirement ages, for example. For the moment, we have barriers. We complain about the fact that older people are costly, but at the same time, we don't let them continue to contribute. So this is, there are many areas. We need to have a totally different approach to aging, and certainly making people more actively involved, not only in the labor market, but in their community in general, is going to be beneficial not only for the person themselves, for the older person themselves, but for the communities as well. And there are many ways you can do that, and very interesting projects being implemented. You have to rethink the way you build the environment, the way the public space is organized, but also the way you organize housing, for example, so that rather than developing solutions where everyone lives separate from the others, you promote and support cooperation between different generations inside the same apartment building, for example, or those kind of things. This is now becoming very trendy. You have very interesting initiatives about the city for tomorrow, which are really taking that on board, as well as all the environmental dimension, which we shouldn't forget, because on that field we are not doing well for the moment. And this is going to have an impact on our lives in the future, much nearer than we think.
There was Andy raising hand. I don't know if you can.
So Andy wants to say something?
Okay, can you hear?
Yeah. Yes.
Okay, yeah. Sorry about the sound problems before. We often have groups of older people when they say to us, our inclusion is being prevented not by complicated things such as high-tech equipment or housing, etc., but simple things that they cannot leave their home because there's no transport, or because there are no public toilets, or because they don't feel safe. And these are problems that we as a UK municipality will try to address. But I think they're wider issues because we have forgotten to include people in our town planning, forgotten to include older people in our transport plans, and very much they feel more isolated as a result of this.
If you want an example of initiative in the transport system, how you can make it more age-friendly, is by using all those possibilities that exist nowadays to help an older person plan their journey. Because you want to move from one place to the next. Of course, you know the area and you know your city, but what about having a problem with the lift? In a metro station, you are not able to take that lift to go back up. So having a GPS that will help you find another route which is adapted to your possibilities, your mobility limitations, and will help you find your way. Or you travel to another city and as an older person, and you know that you will need some medical care, or you need to find a pharmacist, or that there are quite a lot of apps which are being developed for the moment which will support mobility. what we need to introduce in those hubs is the feeling of security when you move out. An older person would really love to be able to call for help in case something happens. There are some models which are some apps which are being developed for persons with disabilities, which could be very useful also for older persons if they are adapted also to their specific limitations like dexterity and so on. So working with the industry, and they are very keen actually on learning more about the needs of their older consumers, but they have to keep in mind that things evolve and that older people would like to find this in the mainstream goods and services rather than niche markets, because niche market products are always going to be more expensive and are only going to be good for one category of limitations, where mainstreaming the needs of older people and persons with disabilities in the mainstream goods is the solution forward. It helps everyone and it's much cheaper.
Further questions for the forum here? I can say a little bit more on the research side also, that we are looking at things like the Human Brain Project to try to model the brain to, for example, look at how to really understand Alzheimer's. We have a big initiative on the virtual physiological human to try to model from genes and cells to organs, so you can really make very personalized medicine. So there are a number of research initiatives that are linked to, say, the more advanced future of healthcare, nano delivery of medicine. There are a lot of possibilities and technologies, but I think, as this discussion also shows, I think we have to combine it with the way it will be useful, how expensive it will be, and what's the purpose of doing it when we look at our society from now to 2050. So I think that will still be an interesting discussion to see how we will drive this evolution forward. But certainly this area is not going to go away. It's going to stay with us for a long time. So we will certainly be there to move the process forward, and I hope you will be actively engaged as well. Good. So with that, I'll leave for Franco to close the workshop. Thanks a lot to Anne-Sophie from my side and from all of you to put in, and we will pick up
Thanks,
all the
Peter.
things you have put into the chat. Thanks.
Let me take the seat. I'm actually sitting here in the same place. Let me thank Anne-Sophie for the great speech. It was I learned quite a lot, actually. That's particularly I'm learning that with these Future Fridays webinars, that very often we are already building the future, actually. And that's quite reconforting. However, there are questions that are not easy to be answered, particularly of the ongoing transformation and the impact that we have on the society, of the technology actually that we see developing very fast, and that are also taken up by the society. So why we are doing the webinars is to engage in a foresight exercise, as mentioned by Peter at the beginning. This foresight exercise is called Digital Futures, and we use the webinars, but also a platform that we have developed called the Futurium to host the content and the synthesis that's of the futures and also policy ideas that emerge from the ongoing engagement with the stakeholders and citizens at large. And so my invitation would be to all the participants to get connected to the Futurium, become a Futurizen, and feel free to pick up one of the visions that are already there, or the futures that are there, or the policy ideas, and further elaborate or challenge the text that is there with questions, or use the wiki to improve it. Actually, I must say that the discussion we had today is very much related definitely to a future that is titled with the Super Centenarian Societies, if I'm not wrong, but also other futures, particularly the impact on welfare, on the job market. It's very, very connected. the intergenerational tensions, which are not necessarily negative, but can be also positive ones. And so it would be great if, as an outcome, as a follow-up of this discussion, there would be some improvement reflected into the futures, because actually, in a couple of months from now, in September or October, we will draw the line and we will actually make a synthesis of all the conversations, and we have had more than 100 so far, that took place around this participatory foresight exercise, which is very fascinating, I must say. But the challenge is always to make sense of what the conversation produced. But we are going to do that, and we will disclose the synthesis of this conversation in the ICT conference in Vilnius. So we plan to deliver 10, 12, let me call it golden hints or key issues the next policy framework should be aware of. When I say next policy framework, I contextualize these in next year, 2014, the change of the European Parliament, the renewal of the College, the European Commission, and we would like really to feed this change with um, ideas coming not only from ongoing trends, but also coming from the future. And that's our challenge. So thanks again. Big thanks to Peter for the great moderations that he did, and to all the participants for their intervention, to Herbert, who was quite active as well, and last but not least to Kasia, who helped us in making all of these possible. Thank you very much.
Bye bye.